Allogeneic stem cell transplantation represents a widely used treatment for children with acute leukemia in first complete remission but carrying high-risk features predicting the occurrence of relapse, and it is also routinely employed to rescue patients who fail conventional therapy. Unfortunately, not all patients have an HLA-identical, either related or an unrelated donor. And for these patients, novel approaches of T-cell depleted haplo-identical transplant using either the father or the mother of the patient have been developed. Through the selective depletion of alpha-beta T lymphocytes, we have been able to document a good prevention of graft versus host disease and a remarkable leukemia-free survival, as published in two papers in Blood, one last year and one a few weeks ago. But when we look at the immune reconstitution of this patient, we found that there was room for improving the recovery of adaptive immunity. And to address this issue, we decided to invest on a novel and original approach based on the infusion of a titrated number of donor T cells which have been genetically modified to the transduction with a safety switch, or if you prefer, a suicide gene. Through this approach, you can infuse these donor T cells, and in case of the occurrence of severe GVHD or GVHD not responding to conventional therapy, you can activate the suicide gene with a prompt elimination of these genetically modified T cells and resolution of GVHD signs and symptoms. In a multi-center study that we have conducted both in Europe and in the US, and which recruited 100 children with either acute lymphoblastic or acute myeloid leukemia, we have been able to demonstrate a very good outcome of the patients with a low risk of transplant-related mortality in the order of 3% and the risk of recurrence in the order of 15%. This means that this patient at 3 years from the allograft had a probability of disease-free survival above 80%. This value being more than competitive with the results that one can obtain using either an HLA-identical sibling or an unrelated volunteer as a donor. The implication is that now pediatricians have a new transplant option to be offered to the patients in need of an allograft, and this will allow us to transplant almost all patients that need to receive this type of procedure. And the other relevant implication is that through this approach, the incidence of immune-mediated complications, namely either acute or chronic graft versus host disease, will be particularly low, this translating into a benefit on the long-term quality of life of surviving patients.